It will be very much helpful that আমরা এখন সবাই বাংলাতেই আছি, যদি আর কিছু কোশ্চেন আসে একটা টেক্সটেই হয় সেটাই ভালো।
No, question must be in text. They can't ask question in voice.
They can't join.
They can't.
No
There is
audio
no option. No audio sound.
Otherwise শিয়ালদা স্টেশনে দাঁড়িয়ে করলে সেই আওয়াজ আসবে।
কোথায় ওরাল প্যাথোলজির মধ্যে আর কি ঢুকে গিয়ে এমন দিয়ে দেবে কোশ্চেন, সে কোন কালে পড়েছি।
আরে চাপ নেই, পিঞ্চ করতে দাও না। The slide we will start the slide, no problem.
ওকে,
সবার শেষে হবে তো, চিন্তা নেই।
না অ্যানসারটা ভয় দেখিয়েছে আমাকে।
আরে না কিচ্ছু হবে না, ছাড়ো তো, চলো।
Okay, doctor, we are already live on the YouTube and the Zoom. We'll just wait for audience to join.
All right, we'll wait.
Now should we move on?
Just hold on, doctor.
Okay.
Yeah, good afternoon, everybody, and welcome everybody to this afternoon. Welcome all the doctors, and let me take the pleasure of welcoming our two eminent speakers today of the day. Let me welcome first Dr. Devamalya Banerjee. Young Dr. Devamalya Banerjee is a graduate of the Haldia Institute of Dental Sciences and Research. He is also the treasurer of the Indian Dental Association of Nadia branch. He is also a practicing dentist at his place. Also, we have amongst us a young and energetic and very cool and calm and knowledgeable Dr. Bezra Dev Burman. Dr. Burman is a prominent dentist from Calcutta. He has passed out his dentist and graduation from Patna Ambedkar Medical College and is practicing today currently at Calcutta. So let me hand over
Good afternoon, everybody.
Over to both of you, doctor. Thank you very much.
Thank you very much. So It gives us an immense pleasure as we can share our little knowledge with all of you. It is a delightful moment for all of us.
Yes.
Mm. And obviously, special thanks to Micro Labs Private Limited for giving us such an opportunity to take participate in this esteemed platform. Obviously, what do you say about this, Dr. Burman?
Actually, we today, especially at the first, we should thanks to Microlabs for this platform. And there is a very interesting topic today we want to share with all of you, my colleagues, my seniors and juniors. The role of curcumin in oral cavity in day-to-day human life. This is a very interesting topic. We should share this with you. Okay. So should
And
we start,
obviously,
Dr.
we'll try to reverberate within all of your mind as much as possible throughout this entire session. And obviously, we'll expect that it will be a nice interactive session. So thank you. And let's start with our topic,
Yes.
role of curcumin in oral lesion. Okay.
Yes.
So I'm going to share my screen. So this is the role of curcumin in oral lesion presented by Dr. Bajradev Burman and myself, Dr. Nirmala Banerjee. Actually, Dr. Bajradev Burman is my senior colleague. So he will initiate the session. Sir, please, comments.
Now we will discuss about the role of curcumin in oral lesions. Actually, there are some type of lesions which we call white lesions and pre-malignant lesions and conditions, just like oral leukoplakia, oral submucous fibrosis, and oral lichen planus. In white lesions, there are leukoplakia, like leukoplakia, white spongy nerves, hereditary white lesions, reactive or inflammatory nicotine stomatitis, actinic keratosis,
And
in
developmental
red lesions.
fibrosis granules.
Yes, due to chewing of betel nut or all these things. Red lesions, angular cheilitis, pyogenic granuloma, burning mouth syndrome, erythroplakia, thermal burn, smoker's palate, peripheral giant granuloma, benign and malignant glossitis.
Actually, Dr. Borman,
Yes.
what is exactly the matter is that the oral medicine chapter, the lesion chapter, is a vast and huge number. So we just want to focus on these selected ones.
Yes.
So we have already mentioned these day-to-day practice, the common diseases, the common lesions. So after completion of white lesions and red lesion, we must commence
the main lesions which we can find in South Asian countries.
Yeah.
Especially in India.
Yeah, right.
Due to lots of oral habits, lots of smoking, betel nut chewing, all those things. So people develop all those things such like oral submucous fibrosis. And all those. Yes.
Now we just want to focus on our
the role of curcumin in
main topic about the curcumin. So Dr. Burman, I must focus on the introduction of this curcumin because everybody of us are very much familiar with this special kind of species curcumin. This is a very domestic purpose use. So in this curcumin, we we are able to know that curcumin is the chief constituent of turmeric, which is also
Yes.
known as haldi, that has proven to be of the therapeutic importance.
Yes.
Its antioxidant properties play a pivotal role in the fighting chronic inflammatory condition. Commercially available curcumin is a combination of three molecules together referred to as curcuminoids.
Yes.
Several preclinical and clinical data have shown therapeutic benefits in various human diseases, including oral, cardiovascular, inflammatory, metabolic, neurological, and skin diseases. Now, the mechanism of action of the curcumin, we can have the two types. The first one is in the case of inflammation, and the second one in the immunomodulation. So, with due permission of Dr. Bordman, I want to focus on the mechanism of
Mechanism of
action.
yes, mechanical
Yeah.
action.
Yes, the curcumin preliminarily exerts its therapeutic effect by inactivation of nuclear factor kappa beta cell. So now the question is, what is this NFKB? The NFKB is a major transcription factor that regulates gene responsible for both the innate and adaptive immune response. Activation of either the T cell or B cell receptor, NFKB becomes activated through distinct signaling components. That is the most epitome work of NFKB. Now, how it regulates the inflammation? Inhibition of NFKB in turn leads to directly to the inhibition of pro-inflammatory cytokines. All we know that the tumor necrosis factor, interleukin 1, interleukin 2, interleukin 6, interleukin 8, and interleukin 12. And when it already happened, automatically it reduces inflammation.
Yes.
Now you can see this diagram. Everybody knows about this diagram. This is we have mentioned this diagram only in order to make everybody understand how NFKB works, how curcumin works in inflammation. So this is the what we have already mentioned in the previous slide, that is written in here. Okay, so now Dr. Bordman will say about the immunomodulation.
Oral.
Dr. Bordman, I have
Yes.
already placed
Just-
this
just-
immunomodulation, right?
Yes. Now we should go through the oral management of curcumin. Curcumin in oral management.
Surely.
Yes.
I
Now
am
see,
going to. Yes,
medicinal
the-
herbs have been used as treatment modalities since ages, from the time of Sushruta. Okay.
Yes.
So many parts of world, not only in India, many parts of world, it has been used variedly throughout human history. The
Yes.
most common natural product from such herbs used for medicinal purpose is polyphenols, because of its most antioxidant effect.
Exactly.
Yes. Now, curcumin is a polyphenol compound isolated from ground rhizomes of the plant Curcuma longa.
Exactly. A
Okay.
family.
Yes.
Curcuma longa is a family. Yeah.
Curcuma longa is the family. It is non-toxic and has a variety of therapeutic properties, including antioxidant, anti-allergic, anti-therapeutic properties, anti-analgesic, anti-inflammatory, antiseptic activities.
Yeah.
It has also anti-carcinogenic activity also.
Yeah.
It
Obviously, you can
has
hear.
chemopreventive, antiseptic activity. All those things are there.
Yeah.
So curcumin has the ability to suppress the acute and chronic inflammation It reduces inflammation by lowering histamine levels and by possibly increasing the production of natural cortisone by adrenal glands. Now the pharmacological actions. Dr. Devmallo, please share some
Sure.
of your views.
Already we have a brief idea about the mechanism of action of the curcumin. But now we are going to a detailed mechanism of action in this
The
slide.
pharmacological action.
Yeah.
Yes.
We already know that it has two types of mechanism. The first is the anti-inflammatory and the immunomodulation. Okay. So how it works? Now we can see in here. Curcumin shows anti-inflammatory effect is by attenuating inflammatory response of tumor necrosis factor alpha stimulated human endothelial cell by interfering with NFKB. We already know about NFKB, no issue. Furthermore, curcumin is also capable of preventing platelet-derived growth factor. We all know that the abbreviation PDGF. Isn't it that, Dr. Borman?
Yes. Very much.
Curcumin has a strong capability for scavenging superoxide radicals, hydrogen peroxide, and nitric oxide from activated macrophage, reducing iron complex. Yeah,
Yes.
and inhibiting lipid peroxidation. It has been shown to scavenge various reactive oxygen species produced by macrophages. These actions may be the major mechanism by which curcumin exhibits its antioxidant activity. In our day-to-day practice life, we always prescribe some of the antioxidants like lycopene. We have prescribed lycopene 5,000 milligram in case of OSM leukoplasia. In every oral lesion, we need an antioxidant. But we must know the mechanism of action of the antioxidant, what we have already mentioned in this slide. This is the mechanism of action of the antioxidant. And curcumin is one of the most efficient antioxidants throughout our entire family of the antioxidant. Isn't it that, Dr. Bowman?
Yes.
Yes.
Now we should focus on the role of curcumin in cancer. Okay. So
Exactly.
now anti-tumor promoting effects. Okay, anti-tumor promoting effects of curcumin were studied and proved. In these studies, it was proved that curcumin showed anti-tumor promoting effects due to the induction of apoptosis in human leukemia cells. Investigations have shown specific inhibitory effect of cyclooxygenesis COX-2 by dietary curcumin in oral cancer, colon cancer cells, and human breast carcinoma cells.
13 and 14.
In addition, curcumin affects a variety of growth factor receptors and cell adhesions molecule involved in tumor growth, angiogenesis, and metastasis.
Yes. Now, apoptosis we have already known, but though in order to give some previous idea, apoptosis is the programmed cell death. Okay.
Yes.
Hmm.
Now, something about oral submucous. Yes. Want to show that thing. Please, Dr. Devmallo, continue.
OSMF is the major case in our day-to-day chamber life, clinic life, because we have 4 stages of OSMF. Everybody will know that. But in case of OSMF, there is no such specific medicine which can reduce the severity of the OSMF within a very short period.
The first thing comes in our mind, I think, about antioxidant to prescribe.
Right. Right.
And
That-
one of the main things, Dr. Devmallo, I want to see with your permission, that the cost factor of that antioxidant and multivitamins and
Exactly.
immunological, boosting therapies, those cost
Yes.
much, too
Yes.
much. And
We
there, I think the role of curcumin is very important.
exactly we prescribe the lycopene 5,000 milligram, but in our commercial prices, the price of the lycopene, there are several brands are there in our market. The price is very much higher and expensive, especially in case of our middle class families, the rural persons, they hard to afford this.
Very
In
much.
case of this, the curcumin is very much beneficial and helpful to those families, as per
Yes.
my little knowledge. What do you say, Dr. Borman,
Yes,
about
yes,
this?
yes. The
And
cost of curcumin and the total cost of therapy of curcumin in various stages will help those people who can't afford the so-called, costly medicines.
yeah, so that's why OSMF we have specially emphasized this point, especially emphasized this region OSMF in this slide. We all know that there are lots of other indications are there. We have a large list of oral lesions in our books, in our all slides, but we must have to emphasize this OSMF. So we all know that it's a pre-cancerous condition. So oral submucous fibrosis (OSMF) is an oral precancerous condition characterized by inflammation and progressive fibrosis of the submucosal tissues, resulting in marked rigidity and trismus. And symptoms of the oral submucous fibrosis, we can find that progressive inability to open the mouth,
Trismus.
what we
Yes.
already know,
Burning
due to
sensation
oral,
in mouth,
yeah, burning sensation,
increased
and
salivation, all those things.
yeah, changes of gastric sensation, hearing loss due to stenosis of the eustachian tube. So
Now
now
here
Dr.
comes the role
Bormon
of
will tell
yes,
us
yes.
the role of the curcumin in OSMF, how it works.
Yes. Now here comes the role of curcumin in OSMF, which is the most important factor. Okay.
Yeah.
Curcumin exerts anti-inflammatory activity by inhibiting a number of different molecules that participates in the process of inflammation. They also exhibit fibrinolytic property due to its ability to inhibit lipid peroxidation and check cellular proliferation, thereby reducing the rate of collagen synthesis. Curcumin mitigates its anti-precancer activities by increasing levels of vitamin C and D and preventing lipid peroxidation and DNA damage.
This is the
Now,
main.
yes. Now, this could be due to curcumin-induced production of vitamin C and D, preventive DNA damage by decreasing the oxidation stress. Other indications such as burning mouth syndrome, antiviral effect, immunomodulation, pain,
Osteoarthritis.
depression, osteoarthritis, these things are there.
Exactly. So now everything we have in the oral lesion. Now I am going to the particular brand
Curcumin,
promotion,
curcuprite.
the Curcumin brand. Actually, we are so much fortunate that our esteemed Microlabs Pharmaceutical Limited launched their product containing curcumin and piperine. So we have this product. Now I am going to that particular slide. Then we will discuss about the uh, other study materials if anyone wants to know about this. So come to our main product, Curcupride, containing curcumin 450 mg and piperine 5 mg. So actually what happened when directly we bought the turmeric powder from the market and we consume it, there is a chance of low absorption.
Yes.
When we take the raw material of the haldi, turmeric, what problem arises? The chance of low absorption. But when we take it through the proper channel, through proper medicinal guideline, that is the particular absorption will take place in our body. So the doses is
2 tablets per day.
one tablet,
One tablet
twice a day, or 2 tablets per day. Exactly.
tablets.
Yeah, 2 tablets per day, like 1 tablet twice a day.
Yes.
And the indication, general immunity,
Arthritis, infections, IBS, CKD,
CKD, oral
submucous fibrosis,
chemotherapy.
chemotherapy.
And obviously, we had everybody knows that all pharmacological books knows that there is a medicine. Obviously, there will be an adverse effect. So here is also
Some side effects.
there exists side effect, adverse effect exists. So mild to moderate diarrhea, headache, rash, yellow stool, nausea, diarrhea.
and diarrhea.
Dr. Borman, you have a case of curcumin.
Yes. Recently after Curcupride, I have seen some one patient only, not some. Actually, in one patient there are some rash. So I put the question to the respective company. So they will answer me. And after all, actually in every medicine there is some chance, for some side effects.
So how you managed at that time?
No, actually, the first
levocetirizine, anything?
No. I just advise them to take some anti-allergic tablets, just like Avil, and after taking 2 days of medicine, he will be all right, and rash don't come back again, though he is now continuing that Curcupride.
Okay. So everything we had already. That is the brand Curcupride. Dr. Borman and me use this brand, and very good
and still using
result. Yeah. So thank you.
Thank you, Dr. Devmale and Dr. Barwan. There are a few questions that are there in the question box. There's one question: is there any chance to change the color of teeth after a few days?
No, I don't think so. If you take raw haldi, as Dr. Devmale said, in India or in South Asian countries, people used to take raw haldi from ancient times. There may be some chance, but in terms of Curcupride, since I am using it from last, from last 1 month, I have not seen till yet. Yet I have not seen any such cases with yellowish teeth or something like that.
Yeah, another person has asked in YouTube, I have geographic tongue for a long time. I am diabetic. Doctor has prescribed. You can read it, doctor, the chat box.
Yes, doctor.
I cannot read this. Okay,
No,
but the geographic tongue.
I am a diabetic. Doctor has prescribed Kenacort oral paste. When it applied, it goes away. After some days, it comes back. What to do?
Look, in the case of geographic tongue, this is a developmental anomaly. Okay, this is not a disease. At first, we have to mention that geographic tongue is not a disease. This is just an anomaly case. All right. So every oral medicine book says that there is no such specific treatment of geographic tongue. Like, I just want to explain. If we have a large oral cavity. So we have the chance to have geographic term. The size of the term, the geographic term, there is lots of factor, but this is not the, at first we have to know that this is not a disease. This is just a developmental anomaly. So there is no question.
One thing is more important, Dr. Devmallo, as I think,
Yeah.
that patient should have to go to a specific oral pathologist first.
Yeah.
Okay. Make his or her oral and oral conditions and conditions of all that is extremely right. Extremely make his teeth clean.
Yeah.
He or she has to check first if there is any adjoining problem with this, such as is he or she having any roughness of teeth and the scratching of tongue, something like
And
that.
at first we have to focus, is there any tongue ties or not?
Yeah. That is also very
So
important.
at first we need a consultation with an oral physician or oral pathologist. But there is no such a difficulty will occur about, regarding this geographic term. So don't take any tension. It will be a regulatory process. Don't worry. Next question.
Next.
Is there any question?
Another question in the question box. Role of curcumin ANUG.
Acute necrotizing ulcerative gingivitis. Yes.
Yes.
Look, we have already mentioned about the mechanism of action of the curcumin in inflammation. Isn't it that?
Yes.
So, ANAG, acute necrotizing ulcerative gingivitis, is the productivity of recurrent gingivitis. So, the role of the curcumin in treatment of the ANAG is a regulatory procedure. Regulatory procedure in this way that this is a precautionary therapy. But when you have already ANAG, if you have already ANAG,
grown up ANAG, yes.
So curcupride or curcumin is not able to alleviate this. So you should have a regulatory pharmacological therapy which we have performed in our day-to-day daily practice. What already mentioned in the periodontics. So you have to undergo the treatment of the periodontology. Effect of the curcumin, mechanism of the curcumin, the treatment given by curcumin is a precautionary measurement. What is the abrupt measurement? Okay. You can have the curcumin simultaneously with the other drugs, but this is not the primary drug which will alleviate your ANAG. Isn't it that, Dr. Bowman?
Yes. That is also a precautionary measure. He or she has to go to a periodontologist and make treatment of that along with some antioxidants, some scaling procedures, and what will be needed for that ANAG. Next.
Can curcumin be given as a monotherapy in OSMF?
Pardon?
Can curcumin be given as a monotherapy in OSMF?
Curcumin can be applied in OSMF, we have already mentioned, but at first we have to focus on the treatment procedure of the OSMF when in case of grade 4 OSMF, we will always put the hyaluronic acid enzyme within the mucosal membrane. Along with, we have prescribed antioxidant throughout 4 to 5 months. But I am continually repeating this word, this effect of the curcumin, the treatment of the curcumin is a precautionary measurement.
Yes.
This is not a primary measurement. If we have already a trismus by OSMF, if we have already a stiffness of the OSMF by fibrosis, So we have to put the injection, the steroid injections, the hyaluronic acid enzymes. But along with this, we will put the antioxidant therapy. Simultaneously, it will go on. Okay.
Sir, how long do you suggest in OSMF?
Look, the span of therapy by antioxidants depend upon the severity of the OSM.
Of the OSM.
Okay, if it is grade 4, maybe it takes a long time of 6 to 8 months.
But the primary suggestion should be of 3 months, I think.
Yeah.
And in terms of curcumin, the Curcupride brand, it should be also prescribed twice a day for 3 months. And thereafter depends upon the minimizing factors of those OSMF, I think.
Sir, role of Curcupride in oral leukoplakia.
Yes. Oral leukoplakia, actually the major treatment plan of the oral leukoplakia by vitamin A therapy. Okay.
Yes.
But vitamin A, we have the brand Retino A, okay, 0.25, 0.125%, the local for local application. We have the across of 25,000 IU, but simultaneously we'll use this antioxidant. What we have already mentioned in our previous slide, if you see, the effect of the antioxidant in oral lesion, anti-inflammatory and immunomodulation. The same effectiveness, the same mechanism of action will apply this leukoplakia also. But obviously, I am going to emphasize on this, the preliminary treatment of the oral leukoplakia will be by vitamin A. But simultaneously, you will have the curcumin in order to achieve the antioxidant effect.
Effect, yes.
Antioxidant effect. What is antioxidant effect? What is the mechanism of action of the antioxidant? We have already mentioned in our previous slide. Okay.
Sir, can Curcupride be used in children acute hepatic gingivostomatitis?
Yes, obviously.
Yes, yeah,
Any
obviously.
kinds of stomatitis, any kind of inflammation we will have in our oral cavity. We can not only oral cavity, throughout our all human body, any kind of inflammation will have. It can be used, it can be cured by the curcumin for long term. Because we already know about the anti-inflammatory effect of the curcumin, which me and Dr. Hormone have already mentioned in the mechanism of action of the curcumin inflammatory procedure, anti-inflammatory procedure. Isn't it that? We have already mentioned about the nuclear factor of kappa light chain enhancer of activation of B cell and T cell. So, through this procedure, we can achieve the anti-inflammatory effect. In any case, not only stomatitis, in case of gingivitis, in case of pharyngitis, in case of tonsillitis, any kind of inflammation, we can control through the long-term period therapy by curcumin.
The major effect of curcumin is to minimize the inflammation, na?
Yes.
The major factor, the main thing we are highlighting, the role of curcumin is to minimize the inflammation. So any kind of body inflammation, not only is oral cavity, in whole human body, we can use as a therapeutic dose, primary medications.
Actually,
then we have to investigate what is the cause of that inflammation, and thereafter we can change our therapy.
So, role of curcumin in recurrent aphthous ulcers. So some documentation is there on that.
Look, Iyengarji, the one thing must understand about this aphthous ulcer or something else, that the previous one question about that stomatitis. These all are the inflammation. What is aphthous ulcer? This is the irregularity or discontinuation of the oral mucosa
Mm.
by through inflammation procedure. After the predisposing factor of the aphthous ulcer is why? The first one is the deficiency of the vitamin B complexes, the
Multivitamin.
nutrients,
Yes.
and by stress, anxiety, and by inflammation. Obviously, there is an inflammation. Through that reason, there is a discontinuity in the oral mucosa. So, the primary treatment of the oral aphthous ulcer is by the choline salicylic acid.
Yes.
But with choline salicylic acid, we would adjoin some vitamin B complexes, some anti-anxiety drugs if necessary. But
Some
if in
antioxidants such as curcumin.
yeah, but in case of the future repetition, in case of the future prospect, in order to alleviate this aphthous ulcer for long time, we can have the antioxidant therapy.
Yes.
It is not correct that if anyone has the oral aphthous ulcer within our buccal mucosa or labial mucosa or anywhere, and we will prescribe the curcumin in the headings of our prescription. It's not correct. We must prescribe first choline salicylic acid, then the vitamin supplements. If necessary, there is the anti-anxiety drugs. Then we have to achieve
Go for.
the antioxidant effect. We can now prescribe the curcumin in order to achieve the prolonged continuation of the therapy. In order to achieve the good prognosis, we can have this
Curcumin.
effect of the curcumin.
Yes.
Isn't it that, Dr. Bowman?
Yes. Yes. Yes.
Okay.
Dr. Devamalli and Dr. Burman, we have Dr. Harsha, our medical officer. Welcome, Dr. Harsha.
Good evening, sir.
Dr. Harsha, you're
Good
listening?
evening.
Yeah.
Good evening.
Good evening, all. Good evening.
Yeah, Dr. Harsha has got something to say and speak.
Nothing much to say. It was a great session, and I think both the doctors have given the overall perspective of curcumin and its uses in the oral diseases. I think nowadays, I think the more focus is like what Dr. Berman said, like is more on the cancer this thing. So it is basically used, to stop the progression of cancer or the precancerous lesions what
Yes.
we usually get. And apart from that, I think this oral submucosal fibrosis itself is considered as a precancerous condition in. So, and use of curcumin, of course, obviously because of its various action, the main
Yes.
being the anti-inflammatory and antioxidant action, it will help in the progression
From
of
time immemorial.
yeah. So Indians knew about the property of
No,
this curcumin
I
since
have
long.
also
And
one concern, Dr. Harsha.
yeah.
I want to say something.
Yeah, sure.
Actually, listen. Everybody is showing their interest about the good effects and everything good about their product and all those things about oral submucous fibrosis and all the oral reasons. But I think we should introduce some of the camps, some of the oral, some of the consciousness program,
Oral awareness
oral
program.
awareness
Yeah.
and consciousness program to as much as we can to the Indian people. The role of curcumin, the role of curcumin should be told to those persons more to more. Some oral consciousness should be there.
Yeah, the awareness programs are there,
It
so
is very
maybe
important.
yeah.
As soon as they get aware, the disease will minimize only then. Otherwise, they will get rid of this. They will again start all those oral habits.
Yeah.
Yeah.
So you kind of see,
We
even
do
a
admit this.
movie, even a movie starts, they show so many things like why people die, and even on the products what they consume. Even over there also they have depicted like it causes cancer, but still people are blunt enough, so they don't listen to the people until unless they have or they start having that disease. It's difficult, but yeah, I agree with Dr. Berman. Like, awareness is one thing which we can, as a medical professional, so probably we can do our part, and rest is up to the people, like how.
Yes, yes, yes.
Yeah.
I
Okay.
don't think, doctor, there are any more questions. I'll just see in the YouTube if there are any questions, doctor. Yeah, there are no questions except one question on role in lichen planus. Role in lichen planus, which
Look, lichen planus is
Planus
an
is a fungal infection.
immunocompromised disease. Okay.
That is a fungal infection
Lichen,
also.
lichen planus is a immunocompromised disease, and it can be cured by tacrolimus. Tacrolimus is the first line of medicine which will cure the lichen planus. Okay, and when we are able to achieve the effect of the tacrolimus, we can use the steroid over the lichen planus. Actually, what happened? Lichen planus is a disease mainly due to stress and anxiety. Okay, it's an immunocompromised disease, and the role of curcumin in lichen planus is yet not been understood. So we don't have any suitable answer on the lichen planus case as it is an immunocompromised disease. You
Once
all
we get
know
update,
about.
we will share.
There is no such study document which can prove that. Yes, obviously, curcumin it has a broadcasting therapeutic effects. Obviously, it may have, it must have, not may have, it must have. But as such, evidence is not there. Yeah, lichen planus can be treated by curcumin or not. So. mm
doctor,
I can.
there is a very big study done by Dr. Vibhas Singh of KPMG Lucknow,
Okay.
who has presented several papers. Let me share that with you at the
Okay.
everybody. This is the study, Dr. Vibhas Singh at the
Treatment
Department of
of
Hotel and
Okay.
treatment
Max.
of lichen planus, a pilot study. Okay.
Yeah, she has done a
Yes.
very big study on this. So this was a
So.
very useful study there. This is an abstract of the study. They
Okay.
showed to
Okay.
have very good
Okay. Okay.
results in that basically. So
We
they
don't
have
have
done.
any idea about this. So, okay, will must be beneficial. You have shared this.
Yes, sir.
Thank you very much.
I don't think there are any more questions, Doctor, for the day. Thank you for the very knowledgeable session and very uh, interactive session that you had. It was very, I'm sure everybody must have liked this session. Thank you, Dr. Devamalia, Dr. Burman, and Dr. Harsha
Okay. Thank
for
you,
witnessing it.
everybody.
Thank you.
And thanks,
Thank you.
thanks, thanks to
Thank
all
you.
of you for giving us such an opportunity to take participate in this esteemed platform.